Let's talk mental health therapies now. They really vary depending on your needs, and maybe you've never heard of EMDR. Well, it's a form of treatment available from Janelle Magruder at her wellness center in Moline. And there's Janelle joining us today. Hi, Janelle. Good
Hello.
to see you again.
Good to see you as well.
I think because it has initials in it, EMDR, I think that sounds somehow a little more intimidating than talk therapy or some other things. So what does it stand for?
It stands for eye movement desensitization and reprocessing, which doesn't help it either.
That clears it right up.
That's right.
Well, let's look at the first graphic, and Janelle can talk us through this. So again, eye movement desensitization, and reprocessing.
Sure.
Don't believe everything you think.
Sure. So the thing that with EMDR, it was discovered, in 1980 by Dr. Francine Shapiro. And a big part of it was addressing, she noticed some eye movements that were happening when people were processing events. And so it moved forward with working with combat veterans and PTSD and seeing how that can alleviate the stressors people have in regards to those conditions. But what was later found out is that it can be used for depression, anxiety, negative belief patterns, addictions, and everything.
So what is the process like if I come to you and I want that kind of therapy? How will that be different from how you might counsel me in a different way?
Sure. So when people think about therapy, they think of traditional talk therapy. When it comes to EMDR, there's actually very little talking done. We believe as EMDR therapists that the brain knows what it needs to do to heal. We just need to get out of the way. And so what happens is that we actually do a lot of things called resourcing, which is people refer to it as coping mechanisms. I like to use the word resourcing because you don't have to have something going on in order to use it. It's a form of self-care to do the things that help you out throughout life.
Can I do that on my own, or it needs to be facilitated by a professional?
Sure, it does. It does. There are some options online that people see on YouTube and everything, but it is a very strong form of therapy, so it's important to have somebody that's trained, or I'm certified in it, to help you along the path with it.
Who do you think it helps the most? What kind of issues or problems?
Negative belief patterns. So individuals believe certain things about themselves that are inaccurate. What ends up happening when people have events in life, the right side of their brain gets overwhelmed, which is where feelings and physical responses happen. And what happens in that moment, it cannot talk to the left side of the brain where logic, reasoning, and language occur. So when people have those shoulda, woulda, couldas, and like, have you ever had that before? The shoulda, woulda, I should have done this, I could have done this.
Oh, sure. I mean, don't we all do that to a certain extent? You look back on something that went wrong and you think, oh, if I just would have done this, but sometimes you can't, if you can't drop that.
Right,
or break it. Yeah.
Exactly. So that's not even a thing. The shoulda, woulda, couldas is not even a thing. It's a shame-built, guilt-built response that we have, but you have access to what you have access to neurologically in that moment. And so what EMDR does is it gives space for the brain to actually heal it by removing us out of the thoughts and the excess out of the way when it comes to it.
If someone comes to you for that therapy, Janelle, is it a one and done, or do you need a series of help?
It's a series of help. So it's an 8-step process, but it's not an 8-session process. There's a lot of things that happen in a session. So the normal assessment to see what you're looking for, determining, coping mechanisms, how well you work with the ones that we have, visualization, and then there's the processing aspect of it where we're actually desensitizing you to the event.
Do you have you seen a lot of great success with it?
Yes. Oh, yes, completely. I'm certified in it, which means I've done a lot of work to get to that point. And there's certain times where I'm just like, wow.
Is that right?
I mean, even this far into it, it's beautiful to watch. I love watching the healing process that people allow them to do, but it is so effective, and I'm just very thankful to know this.
Does it work on children?
Yes.
Really?
Yes, it does.
Okay.
Yes, it does. There's a few modifications for it, and actually it works really well with children because they have less outside noise going on in their neurological pathways to deal with that. So,
well, if you'd be interested in learning more about EMDR or the many other therapies that you provide at your business, Janelle, we'll put up the information for Magruder Wellness. Janelle, great having you back.
Thank you
so much.